Matthew was born July 3rd, uneventful. I mean, we just went in, normal delivery, got to take him home the next day.
Matthew is almost 4. He's been my patient since birth.
After about a year and a half, he just wasn't gaining weight. And we kind of addressed those concerns, but he never showed anything to give us any indication there was anything wrong.
He came back then at his 2-year checkup, and at that point he had had no weight gain from his 18-month checkup. So he basically was falling off the growth curve at that time.
We started seeing a gastroenterologist, and we were trying to work him up for all kinds of stomach ailments, something that, is it a diet issue, is it a stomach issue? Started having the vomiting. And
every day, 8 o'clock. I mean, it was
he'd
like
wake
clock.
up throwing up, and we just couldn't figure out what was wrong.
But never a fever.
We did basic blood work, we did electrolyte panels, we did thyroid tests, we did Epstein-Barr tests, we did lots of evaluation, we did a sweat test for cystic fibrosis, and everything was normal.
Dr. Sawyer had done such a good job of working him up. They knew what it wasn't, so they knew to start looking at other things.
Every time we would try to feed him, he would throw up. So I was in contact with his GI doctor, and we were thinking maybe he had some kind of a malabsorption syndrome, or he was having some kind of a physical obstruction. And we discussed possible transfer to a higher level of care because I couldn't get him to gain weight even in the hospital, but they transferred him at about 10 o'clock at night because they were ready for him, and set him up for a CT scan at Dell first and found a big brain tumor. It's a pylomyxoid astrocytoma, which is extremely, extremely rare. It is a benign tumor, meaning it doesn't really, if you can take it out, you treat it, but with where it was in his brain, it was very difficult to remove.
So what they recommended was going in and debulking it, removing as much as they could, knowing that there are risks involved.
And they placed what's called a shunt in his brain because he was having so much pressure in his brain. He was recovering from that, but he actually got an infection of that shunt, so they had to take it back out. So that's 2 brain surgeries, and on his 3rd brain surgery, they went back to try to remove more tumor, and unfortunately during that procedure, he ended up having a stroke. This tumor is so rare that they found a study from 2011 with a total of 8 children, and they decided that it was best for him to also go through with the chemotherapy from that study. Because of where we live here in San Angelo, it wasn't going to be feasible for them to stay at Dell for a year, so they ended up transferring his care to Cook's Children's Hospital so they could start chemotherapy in Dallas with the thought that he could come on here to San Angelo and finish his chemotherapy.
Matthew's treatments while he was here consisted of IV hydration, and then he also had to get chemotherapy. And he was here from August till December when he had his last one, so every 4 weeks he was here for at least 6 to 8 hours.
What was in there did shrink. The mets in his spine did disappear, and they didn't see any other growth anywhere else. So they called it just stable disease.
They were able to start him on physical therapy, speech therapy, and even occupational therapy just to learn how to walk again.
He completely transformed into a regular toddler again. I mean, that's amazing to see, and that kids can have that resilience and come back. And there's a lot of adults that lose that, but Matthew didn't. He was smiling, he was talking, he was playing, he was a regular kid, and we were able to see all of that happen again.
The fact that he was able to go through 3 brain surgeries, a stroke, and still be able to smile and now walk and run is really amazing. Really a miracle that he's alive.
I never would have thought we would have used CMN. If you think about the equipment, if you think about the toys, if you think about whatever they need to help take care of our kids here in San Angelo, it made a difference for us because we didn't have to leave once a month.
For someone to have to go through what they went through and come out on the other end and be willing to share their story and say, hey, this happens, but you can get through it, that's a miracle, and that they can share it with other people so they know that they're not alone.
Please help support Children's Miracle Network
and support a miracle kid like Matthew.